I'd like to spend just a few minutes talking to you about headaches. Headaches are probably one of the most common conditions that people suffer with. I mean, there are millions, billions of dollars worth of medication sold every year to treat and manage the pain of headaches. There are various degrees of headaches, from tension headaches all the way to severe migraine headaches. And for any of those of you who have suffered a migraine, there's nothing worse. And even to the point you go to the hospital and have injections to try to deal with the pain. There are a lot of different causes of headaches. And so it's really a matter of systematically going through and ruling each of those out. Headaches are kind of a catch-all diagnosis. The therapy is the same, pain pills. So one of the most common causes of headache has to do with upper cervical spine imbalances. Each vertebra in the spine moves through a certain plane of motion. You've got intersegmental muscles that control each vertebra. You've got muscles that control the occiput to the cervical spine. And muscle tension builds for various reasons and can lead to suboccipital pain. One of the most common causes of muscle tension is low blood sugar. So if a person's blood sugar drops below a certain percent, then specific muscles in the back of the neck go into a state of contraction. And when a muscle becomes overloaded beyond its ability to handle stress, many times the receptors in the muscle attachments inhibit the muscle. And so the more you stress the muscle, the more you inflame those attachments. And anytime an attachment becomes inflamed, it refers into the bone it attaches to. So based on the occiput, the base of the skull, any muscle that attaches back there that's not working properly or is being stressed can cause pain referring throughout the skull. Stress of just emotional stress, physical stress, eating something you're allergic to can cause enough overload to flare that up. Another common cause of headaches is allergy to foods. And so oftentimes people will note that when they eat certain foods, they get headaches. We're seeing more and more of that, especially with the genetically modified foods that we're consuming in today's world. And that's a real problem that's going to cause more and more problems as time goes on. Another big cause of headaches are sinus problems. And the sinus membranes are very sensitive, and so if you get any kind of inflammation or swelling, that can create some really intense pain, especially through the frontal area of the skull. And sinus medications are used to try to manage that. We use a technique called a cranial nasal specific, which corrects that and will remove migraines just like that, if that's the source. Another common cause of migraine headaches is problems with the teeth. We're finding more and more that root canals, old root canals, can be the site of low-grade infection that may not be symptomatic per se, but they can cause referred type pain within the cranial mechanism. So root canals are another cause. Another potential cause of migraine headaches has to do with concussions, head injuries that have occurred that lead to the bones of the skull becoming restricted to their proper movement pattern. There are sutural lines within the cranium that allow the skull to move when we breathe. And a lot of people sustain head injuries. Their headaches for a while, then they go away, and then they periodically flare up. It can be caused because of the cranial distortion. And again, the cranial work that we do can have tremendous impact on correcting those types of problems. Another common cause that we're seeing in our older population is a hole in the heart. There's a structure called the foramen ovale, which goes between the chambers of the heart when a baby's in the womb. And once you're born, that foramen is supposed to close off. And we're finding that a certain number of our population have never had that foraminal valley closed. And so they're finding that people who, like in their 40s or 50s, who begin to experience shortness of breath when they exercise, headaches, they're really dealing with a problem with the foramen not closing. And what that leads to is the oxygenation of the blood shifts. The oxygenated blood on one side of the heart chamber mixes with the non-oxygenated blood on the other side, and so your circulation is affected as far as oxygen carrying capacity of the blood, and that's pretty much what leads to the fatigue. But that phenomenon can be the cause of headaches, and in that case, people need to be evaluated by a cardiologist. So headaches are something you just don't manage with over-the-counter drugs. You got to find the cause, because if you don't, it can lead to other problems over time. So in our model, we define the cause of the symptom, because once you define the cause of the symptom, then you implement the proper therapy to assist the body in healing that condition, so you don't have to deal with it for the rest of your life. And that's the difference between the medical model, which is the diagnosis and treatment of disease and pathology, and this model, which actually deals with looking at function or deviation from normal function, defining the source of the problem, and then implementing therapy to help the body heal and correct that problem.